The research describes 21 children who became unwell shortly after drinking a drink which contained glycerol in the form of a slush ice drink, also known as a slushy. We described the symptoms associated with it and the biochemistry. This constitutes a clinical syndrome called glycerol intoxication syndrome. Traditionally, to maintain that slush ice texture, you needed very high levels of sugar, but more recently, because of public health concerns, there's a move away from to find substitutes to sugar, and glycerol is very useful in that regard. It acts as a kind of an antifreeze, so it replaces the sugar in that regard, and it's also a sweetener, so it's a useful substance for these drinks. But what we've discovered is it can be used in very high amounts in some slushies, and that's toxic to small children. There's no doubt that it's fine in small doses, it's ubiquitous, but in very high doses it interferes with the metabolism of small children. It overwhelms the liver and their blood sugar drops. The children came in, most of them had a sudden onset of reduced consciousness or coma. One child had a seizure. They also had, when they arrived at the ED, their blood sugars were dangerously low, and they all had levels of acid in their blood. That's an unusual presentation to a children's emergency department, but there is a kind of a protocol when a child presents like that. We do metabolic tests. This is the first time that glycerol intoxication syndrome has been properly described in children. Thankfully, all of the children made a good recovery and haven't had subsequent problems. So the paper is very useful to the clinical community in terms of identifying these children and diagnosing it quickly. The Royal College of Emergency Medicine produced what's called a safety flash, directed particularly at staff of emergency departments so that they would be aware of this and recognise it. Cases in this study have informed policy in the UK and in Ireland. Authorities in Ireland and in the UK have issued guidance that these drinks should not be given to children under 4, and that for children under 10 they shouldn't be offered free refills. There should be a maximum of 1 in a day. The Irish Food Safety Authority is liaising also with European colleagues I understand it's being looked at a European level. Our study adds to the knowledge base around glycerol and child health and will be useful to policymakers in both regards.